Okay. So this is 2-1. See the anatomy, see the outline. Nasal floor, the crest is thin, the zob. There is a concavity here. Mostly it will be close to lateral, I guess. When you see the concavity, it is red. Palatal slope. Nasal floor is good. We see what is the ounce-fill unit near nasal floor. 1800. Now we are saved. Okay. So you have two options. One is going through the crest or bypassing the crest, like this. Okay. Anything is fine. One more advantage with multi-unit implant is not much bending is needed because some amount of angle correction is already there. Okay, the length is around 17, that means you can place an 18 mm implants. Of course, before surgery we will be measuring, we will be keeping a scale here, we will analyze the prosthetic space. If needed, we may need to do alveoloplasty. We need 14 to 16 mm from here usually. Okay. So if we do alveoloplasty, then we may have to reduce the implant length. Of course, in the anterior implant, we have to avoid the incisive canal. Already you know, see it is little close. Okay. Now we see the 1-1 implant. This is 1-1. Cancellous bone. Only the nasal floor is good. Okay. See, if you place like this, like alveolar bypass, only 13 mm is coming. But if you slant and place like this, okay, the length is increasing. So remember this logic. The more you tilt palatally, the more length you will get. The more you try to place implant straight, the less length. But if you place more palatally, the abutment will come more labially. The more you place straight, the abutment will come in a more favorable way. So some kind of compromise we have to get. So I won't do such kind of angulation because my abutment will come very much. So this is quite a good compromise. Okay, the abutment will come in a good decent position. Some height also will. Now we will plan for the second implant on the right side. You see, that is what I was telling, the sinus expansion. Imagine if the sinus stopped till here. Okay, if the patient has come before 2 years, the sinus will be here. But slowly it has expanded. That is a problem. So just immediately next to the implant, we can place here. Even if it is slightly close to the sinus. This plan looks okay. See here, it is not invading the sinus. We see the buccal in the cross section. So here also there is severe ridge resorption. Knife edge, we are going to do the bypass kind of thing. And nasal floor will save us. It is good stability. It is around 1100. So anteriorly 2 implant is enough. Now we will. And one more plan is you can just slightly tilt mesially and go distally. Okay. This is just complicating the matters. We will place straight to straight. And we will see whether we can do some implant here. Some good bone is there. Not very good, but maybe 4.2 to 10 something we can place. Okay, but exactly here we have to drill. If you drill here, you will enter the sinus. How to find this? Okay, one thing is find out the tuberosity from here, how much mm it is there. We will find it out. Okay. From here, it is around maybe 17 mm. Okay, from the notch For prosthetics, we'll be using a notch, no? Border molding. From there, it is around 17 mm. You can drill and check. Okay. If you do drilling here, you will immediately enter the sinus. Then we can do the drilling by drilling, poking somewhere. No, you can find out the right spot. So this is one option we are keeping. And the important implant is the pterygoid implant. Pterygoid implant we will discuss in depth tomorrow morning. Okay. If you see, the sinus has come down till here. If the sinus is still here, we can place a good pterygoid. Yes, that is the challenge. Exactly that spot. See, it is very buccolingual, it is very thin also. Okay. So, pterygoid implant is a separate. So, pterygoid implant is a separate discussion that we will do tomorrow. Okay. So, this is the tuberosity, right? This is the tuberosity. It goes through the tuberosity. This is an entirely separate bone. It enters the pterygoid plate, pterygoid bone. Okay. We will try. If the pterygoid is not working out, we will.
Where is the point of entry in the oral cavity?
Yeah, just in front of the notch. This is a notch, right?
Okay.
In front of it, or some to 8 mm. See, if that is good, if the sinus is still here, we can start more anteriorly also. So, as I told, from where to start, what angle to go. These are all things. Now, we will go to the left side, 2-3 implant. This is just next to the 2-1 or 2-2 implant. Here also we may have to do palatal bypass. Okay. Or what we can do is we can start the implant from the premolar. This is the first premolar, right? I don't know. You can tilt mesially, similar to Alan. .2 into 20 we can place. This is also one option. Okay. Either you can place one implant straight, or if you place tilted, you are pushing the abutment slightly distally, reducing the inter-implant distance. So right side we will be placing one straight, but here we will be tilting, because here the sinus floor is little bit favorable, but here it came very much forward and it prevents tilting. Okay. So the sinus angulation, what is the anterior sinus wall? What is the angulation? Whether it is too vertical, or it will determine whether you can tilt. So these things you can plan. See the difference between the sinus. Right, it is very much down here, but here so in the palatal socket of 6, some good bone is there. Okay. Beyond the socket wall, there is some good bone, and till sinus floor you can reach. Okay, that is one option we can keep. 4.2 into 13 we can place. Now we try pterygoid also. Okay. The pterygoid is more challenging than the right side. The sinus is coming till here. Distal wall of maxilla it is going. Okay. Now we'll see. If we get good stability here, our first option will be here. If we are getting nice good stability, we won't do pterygoid. Okay. So we'll start. So those 3 people who didn't come for the lower jaw, we will start. No, it is straight multi-unit. The body will be straight. I will show some.
It was tilted slightly.
It was tilted. Simple dent, it is 15 degree.
Yeah, that's what I'm asking. Like 15 degree.
Okay.
In the side கொடுக்கணும்ன்றது while it's
They
screwing
given,
you have to decide.
they are given a carrier along with it. Okay. There is an indicator in that carrier. It will tell in which direction the 15 degree is.
So while placing we have to adjust accordingly.
Adjust accordingly. Yes. Okay. That is the problem with the simple dent. 15 degree they are giving angulation. During incision gives
Yeah, and like if it stops with that, then we have to do
yes,
it.
yes, yes. So violin is somewhat completely straight.
Oh, that's straight.
That is straight. Only by bending you can adjust some.
Okay.
So